Hi, it's Dr. Centeno, and this is part 3 of my 3-part series, How to Rehab from CCI. This is matching your functional level. So like, comment, share, and subscribe because that's how we get this information out to more patients like you. So this is a 3-part series. I started out with threading the needle, then we went on to rehab strategies. Now we're at matching your functional level. There are also deep dive videos that can even take you deeper into these topics. So what rehab interventions look like by functional level? Now, I often tell patients this is a little bit like climbing out of the hole, right? We've got patients who are very functional. It's not going to take them very long to get back to normal. But we've also got patients that are bedbound and have been for years. So it's going to take them longer to get rehabbed. It might take years to get back where they need to be. Now, all of this basically is threading the needle. And I've talked about that before, but here you take your level of disability, you try the appropriate rehab strategy for that level, and if your symptoms are manageable, you can then increase the rehab strategy difficulty and hopefully get to the next functional level. But if you can't do that, you got to drop back to where you started, meaning if the symptoms get too much. And you might even need an intervention to allow you to get to where you want to be, something like a PICL procedure, for example. Now, these are the different functional levels, everything from bedbound, very limited, limited, mostly functional, functional. So if you're bedbound, you've got to start really slow. Your goal is just to spend more time each day out of bed. So you might want to use a properly fitted cervical collar to get upright. You may want to use AO or NACCA chiropractic to help reduce symptoms. And you can even try slow and deliberate neck range of motion exercises while you're supine or reclined. But basically, it's trying something to get out of bed. It might just be getting out of bed just for a minute or two a day, or 10 minutes, or 20 minutes, or 30 minutes, and building on that. Now, for somebody who's very limited, and that means that they really can't be upright all day, they need to lay down for at least a couple of hours. Again, if you're using a collar now, because now your goal is different, right? Your goal is to stay out of bed, but also start to gain some low-level strength and endurance. So if you're using a collar, then begin to wean it by several minutes each day. Try to reduce the amount of time that you spend laying down, maybe just a few minutes each day. Try walking for a few minutes and try to increase that time a little bit each day. You can use AO NACCA chiropractic to try to manage symptoms. You might want to try to begin those low-level laser exercises that we have online. You may want to try a towel test to see if you can tolerate curve restoration. You may even want to see a CBP chiropractor if you can tolerate that, and those can be found at idealspine.com. And if you have significant visual issues, consider formal vision therapy optometry. And you may want to just start low-level work on your structure and posture. And that might just be doing things like opening your chest and your hips and getting your head and neck back. Again, follow that postural progression that is in the second video. Now, if you're limited and you can spend all day upright, but you have to significantly limit what you do to manage your symptoms, the goal is to gain strength and function, meaning to be able to do more things with fewer symptoms. So again, try to wean out of the collar, start trying to walk a little bit more, getting up to 10,000 steps a day. Use the AO NACCA chiropractic to help reduce symptoms. You can try those low-level laser exercises online. You can try to see if you're appropriate for curve restoration. If you've got significant visual issues, you might consider formal vision therapy optometry and work on your structure. At this point, probably considering online postural work, which is listed in that second video. Now, if you're mostly functional, if you can do most things without symptoms, but you can't exercise or limit exercise to manage your symptoms, the goal is to transition into daily exercise. So at this point, you'd really want to be walking 10,000 steps a day. You can use AO and NACCA chiropractic to manage symptoms. And you can also really see if you can tolerate curve correction, because this is a good place to really get that curve back. Consider the online postural work that we were talking about. and begin adding back some low weights in the gym, high rep work with perfect posture and making sure that you're keeping your symptoms managed. And you might even consider seeing an IPA physical therapist. And then finally, this is where we all want to get to. That is, we're fully functional and can exercise with no or very minimal symptoms. The goal is to live your life and be active. And obviously, again, you might start at bedbound, or you might start in the middle, or you might start as mostly functional. But again, thread that needle to get where you need to be. So in summary, rehabbing from craniocervical instability is possible. However, you need to learn how to thread the needle throughout all of these things, and that was discussed in that second video. And what's really introduced here is you need to begin at your functional level and move forward from there. If you start at a low functional level, your rehab could take a long time. If you can't advance your rehab, then that's when orthobiologic interventions come in. So again, like, comment, share, and subscribe. There are deeper dive videos here as well to get into these topics more deeply. And thanks so much for watching.